All right, you're live.
Hey guys, Matthew here with Dr. Emer's office. We have a patient who is scheduled to get a pretty fun surgery tomorrow. He's getting HD-Liposuction done to his entire body. So today we're actually preparing our patient with an IV infusion that's custom made for each patient, depending on what they need, to help with them recovering after surgery. So this IV here has a mixture of vitamins and additions that are going to help reduce that inflammation, the bruising, and overall reduce the downtime that's associated with these big surgeries. So our patient is here getting the infusion, and a lot of our patients, they get pre-operative IVs as well as post-operative. So they can do as little as 3 or as much as 14 or 20 or as many as they'd like. And this reduces the downtime. So the inflammation that's associated with liposuction, a lot of doctors don't emphasize on infusions and hydrating and getting these vitamins that are imperative for patients to return back to their baseline. Also, this is done with our other post-operative procedures, such as hyperbaric oxygen, which is definitely going to hyperoxygenate your tissues and help reduce that bruising and inflammation and fluid retention that we see from surgeries. So it's comfortable, it's not a huge time commitment. It's a great option for patients to do pre-operatively and post-operatively.
Great. So what other post-operative treatments can you combine this with if you're getting HD-Lipo?
Yeah, so with HD-Lipo, we do have other infusions such as NAD. That's also going to help revive those patients and give them that energy boost to get them back on their feet. Most of our patients are definitely fine, but the IVs and post-operative treatments such as the hyperbaric oxygen or the lymphatic massages, if you guys have been tuned into our lives, you'll see a lot of those. And those definitely help, all combined to help our patients heal faster, get better results, and just an overall balance of those electrolytes and vitamins that are imperative for healing.
Mm-hmm. And who can benefit from IV therapy if they're not getting HD-Lipo and they just want IV therapy?
Yeah, so anyone can benefit from IV therapy. It really just depends on the patient's needs. If you schedule a consult with us, we're more than happy to assess what you need and recommend the right infusion, because everybody's customized their treatment, and we're happy to get you infused with whatever you need, as often as weekly or as little as semi-annually. Whatever's going to give you that extra boost.
They're asking what's in his specific anti-inflammatory IV.
So this is a mixture of different vitamins, B12 complex, we got calcium, we got a whole range of glutathione, we have a huge range of mixes, and again, they are custom tailored to our surgical patients, so it's not the same IV that you just get anywhere. They're all custom dosed, and this again helps with our surgical patients. This particular one we call prime time, and the prime time is just before surgery.
So what is this going to prepare him with, basically, to boost his system for the surgery?
For healing, yeah.
Mm-hmm.
So after surgery, we generally have, bruising, swelling, some, edema. This is going to help deflate that, get rid of that bruising, get the patient healed as fast as possible. So this is definitely going to benefit, that whole blood flow and getting them healed a lot quicker.
Mm-hmm. For those of you asking about the cost, if you're interested in cost, make sure to reach out to our social media, DM us, or email appointments@jasonmrmd.com for more info. Like he said, each treatment is customized to the patient, so the pricing will vary depending on your particular case.
Exactly.
Mm-hmm.
We definitely do packages too, so after we custom tailor what you need, we can definitely work out a treatment plan for you.
Great.
All right, thank you guys for tuning in, and I'm sure you'll tune in later for another live tomorrow.
Bye.
Bye, guys. I hope you learned some.
Right, yeah.